Princess Kate's visit to Evelina London Children's Hospital became far more than a royal diary engagement when a small, tender exchange with a 3-year-old patient captured the attention of viewers across the country. The Princess of Wales was there to meet children receiving specialist care, speak with families, and learn about the hospital's growing plans for the future. But it was a simple blown kiss, shared between Kate and a young boy named Arjun, that turned an official visit into one of the most emotional royal moments of the week. Arjun has been receiving treatment for a rare pulmonary vein condition after suffering a cardiac arrest earlier this year. For any family, the experience of watching a child go through serious medical treatment can be frightening and exhausting. Hospital corridors become part of daily life. Medical conversations replace ordinary routines. That is why moments of warmth can matter so much. During the visit, Kate sat with Arjun, spoke with his parents, and joined him in a conversation about toy dinosaurs. When the little boy made an affectionate gesture toward her, the princess responded by blowing him a kiss. It was brief, it was quiet, but it carried a message that royal visits are often designed to deliver. Children in hospital are not only patients. They are children with personalities, fears, interests, families, and hopes of returning home. Arjun was reportedly due to leave hospital shortly after the visit, making the moment feel even more significant for a family approaching an important turning point. Kate's appearance at Evelina London Children's Hospital was not a random stop. She has been patron of the hospital since 2018, and her support reflects a long-standing interest in early childhood development, family well-being, and the pressures facing young people. The visit also came as Evelina London continues work toward a major expansion designed to strengthen specialist care for children across London and the southeast of England. The hospital's plans include a new building expected to open in the early 2030s, with the ambition of creating one of the capital's most comprehensive and integrated children's hospitals. The project is not simply about larger buildings or new equipment. It is about bringing complex services closer together so children and families can receive specialist care in a more coordinated way. That includes plans for a future children's cancer principal treatment center developed through collaboration with the Royal Marsden and St. George's Hospital. This is where the visit becomes bigger than a touching royal clip. Hospitals often face the difficult task of explaining why investment in children's services cannot wait. A public visit from the Princess of Wales helps put human faces at the center of that conversation. It gives staff, patients, and parents a platform. It also reminds the public that behind every fundraising target and expansion plan are families whose lives depend on timely, expert care. Kate spent time meeting staff, young patients, and parents in the hospital's cardiac unit. Her focus was not only on the children receiving treatment, but also on the people supporting them through long days and uncertain nights. Parents of seriously ill children often carry enormous emotional pressure while trying to remain calm for their child. Medical teams work under intense responsibility. A royal engagement cannot solve those challenges, but it can shine a light on them and acknowledge the people living through them. The princess's own recent experiences have added another layer to public interest in her hospital visits. After revealing her cancer diagnosis in 2024 and later confirming that she had completed treatment, Kate has returned gradually to public duties. That history has made health-related engagements especially meaningful to many observers. Still, it is important to keep the focus where it belongs, on the children, families, and healthcare professionals at Evelina London. Kate has not presented herself as an expert on medicine, and she does not need to. Her role is different. She can use visibility to support institutions, encourage public attention, and help make difficult subjects easier to discuss. In a hospital setting, that means listening carefully, showing respect for staff, and allowing young patients to lead the interaction in their own way. The dinosaur conversation with Arjun showed exactly why these unscripted moments often resonate more than formal speeches. Children do not respond to titles or protocol in the same way adults do. They respond to playfulness, attention, and kindness. A toy dinosaur can become the center of a conversation. A shy smile can become a shared laugh. A blown kiss can become the image people remember long after the cameras leave. The reaction online reflected that emotional impact. Many royal followers praised the princess for appearing relaxed and attentive with the children. Others focused on Arjun's courage and the strength shown by families dealing with serious health challenges. The strongest response, however, was not really about fashion, royal status, or ceremony. It was about the reality of children receiving care and the importance of making them feel seen. There is also a wider royal significance. The modern monarchy is often judged by whether it can connect with people beyond grand ceremonies and historic traditions. Hospital visits are among the clearest examples of how royal work can become personal. They are not about palace balconies or state banquets. They are about meeting people at vulnerable moments and helping bring attention to causes that need public support. For Kate, this engagement also reinforced the kind of public role she has steadily developed over the years. She has often focused on children, families, mental health, and early years development. Those subjects may not always create dramatic headlines, but they affect millions of people. By returning to Evelina London in her role as patron, she connected a familiar cause with a new chapter in the hospital's future. The visit also offered a reminder that progress in children's healthcare depends on more than goodwill. It requires specialist teams, research, modern facilities, fundraising, and long-term planning. Evelina London's expansion is a major undertaking, and the campaign to support it will require sustained public engagement. High-profile visits can help generate awareness, but the real work belongs to the clinicians, researchers, charity teams, donors, and families who continue pushing for better care. As Kate left the hospital, the images that remained were not those of a formal royal procession. They were images of a future queen sitting beside a little boy, talking about dinosaurs, and returning a gesture of affection with a blown kiss. In a world where royal news can often be dominated by controversy, distance, and speculation, this was a moment built on something simpler: compassion. For Arjun and his family, the visit may have been a bright moment during a difficult journey. For Evelina London, it was an opportunity to highlight the work taking place inside its wards and the vision shaping its future. And for the public, it was a reminder that even the smallest gestures can carry real emotional weight when they happen at the right time. Do you think moments like Princess Kate's visit to Evelina London Children's Hospital show the most meaningful side of royal work? Share your thoughts in the comments, and remember to like, comment, subscribe, and share for more royal news and analysis.